This is The Need Theory by Virginia Henderson. Virginia Henderson is known as the modern-day mother of nursing. She was born in Kansas City, Missouri. She was the fifth born in 8 children. Her parents were Daniel B. Henderson and Lucia Bott. She got her education in the Army School of Nursing in Washington, D.C. at Walter Reed Hospital. She joined Norfolk Protestant Hospital in 1923, and she taught nursing. She joined the Teachers College in 1929 at Columbia University, where she achieved her master's degree between 1932 to 1934. She inspired healthcare professionals in universities, governments, and societies worldwide, encompassing the nursing theory. Henderson's need theory came from her desire to help the sick and injured in the military during World War I. Henderson revised an edition of textbook and principles and practices of nursing. She also oversaw the creation of the Nursing Studies Index. She is also the recipient of many honors and awards, including the prestigious Christine Romain Prize of the International Nursing Council. The purpose of the need theory is to enhance patients' interdependence and concentrate on basic needs to avoid lags in progress after hospitalization. The goal was to not develop a theory but to define the unique focus of nursing practice. Her type of theory is called a grand theory. Her theory includes all aspects of human needs and addresses them all. It originated in 1939 when she authored 3 editions of the nursing profession, published then in 1966 and revised them in 1972. Such literature were guidelines for healthcare experts for exceptional service delivery, focusing on patients' well-being. Virginia's theory incorporated a formidable achievement in nursing, which she acquired through a research project where she collected, assessed, cataloged, and annotated every research piece in the nursing sector published in English. The major concept of Person to Henderson is that interdependence is to ensure that progress after being hospitalized is not delayed. Henderson also believes that the primary focus should be on basic human needs. Patients also may require help to get independence and health. Virginia's concept of environment explains that the environment has various settings where an individual acquires unique ways of living. So the external conditions affect life and include individuals in their relationships with families. The 14 components cover social, spiritual, physiological, psychological areas. The first 9 cover physiological aspects, while the 10th and 14th components are psychological. The 11th covers moral and spiritual aspects, whereas the 12th and 13th are sociological. The environment has a big part to play with regards to providing a safe haven for the patient to recover very well. The concept of health looks at the ability of an individual to operate independently. As explained in the 14 components, nurses are thus urged to stress the promotion of good health, prevention mechanisms, and the cure of the disease. In their interactions with patients, nurses therefore have the duty to ensure that their patients have the best care. As argued by Henderson, achieving good health is a challenge as there are so many factors affecting it, including emotional balance, age, and cultural background. Therefore, there is a need to consider these elements while caring for the sick so that their health is managed appropriately. In the nursing concept, nurses are urged to do for others what they would wish to do for themselves, kind of like the golden rule. Nurses have to make patients independent of them and carry out therapeutic plans set forth by the physicians. They can also exercise creativity and come up with individualized plans for caring for patients. The duty of nurses at all times is thus to make independent judgments that can be of benefit to patients. They are also expected to assess the needs of patients and help meet them independently. Henderson's theory focuses on the need to increase the independence of patients to fasten their healing in the hospital. Nurses are thus tasked with ensuring that the supplementary, and complementary roles are executed for the benefit of the patients. These roles include doing the necessary task for the patient, helping the various patients and working with all patients respectively. Henderson's theory also stresses how the nursing staff can assist in meeting the basic human needs of their patients. The needs of patients are closely related to their health, and the necessity that nurses meet is improving the health of these patients by all means. Henderson's need theory has various assumptions, including that nurses must assist all the people that have illnesses. They should be independent of the physician, and the 14 elements of the nursing need theory describe the needs of patients and the nursing functions. It also assumes that the nursing goals are attained when there is a symbiotic relationship between patients and nurses. The other assumptions that patients and families are interrelated, and nurses should assist patients in attaining independence. Illnesses are affected by environmental conditions, and nurses should aim at maintaining a safe environment for their patients. The need theory also assumes that nurses should also be culturally competent and have to maintain the best practice methods while executing their nursing functions. The need theory argues that nurses are helpers, assistants, and companions to patients, ensuring their health and well-being. The aspect of having a relationship is that when patients are sick, nurses help them get well and recover. This is aimed at ensuring that the health aspect is achieved at all times. While patients are recovering, nurses assist patients in achieving their independence, which is the primary role of the need theory. Nurses are also a companion when planning the provision of care, when setting goals, and developing preventative maintenance initiatives. The roles of nurses are thus enshrined in Henderson's theory and are critical in ensuring the health of patients. One of the limitations of Henderson's need theory is that it has no conceptual linkage among the physiological and other distinct human characteristics. The concept of the human being is also not defined holistically in this theory, so the 14 components which are prioritized do not have a clear ranking starting with the highest in importance. The fact that nurses help the patient in the dying process is not clearly defined as to what nurses should do. The role of nurses in ensuring a peaceful death, as explained in Henderson's theory, is curious and has not been explicitly explained. Also, the independence of patients, which is explained in the need theory, is not achievable by all patients that seek medical care. Henderson's works are more than just theories and have been included in reputable areas such as the Principles of Practice of Nursing and Nursing Studies Index. Henderson's philosophies have thus become foundations for nursing research and education. Her propositions, which are based on scientific foundations, also portray nursing as an important art, arguing that patients should be treated as individuals with distinct basic needs to achieve their essential nursing care in varied hospital settings. The argument that nursing is more than following the orders of lead physicians cements the importance of nursing in ensuring that all the needs of patients are met. Henderson's theory is critical in guiding the nursing practice to promote the achievement of optimal patient outcomes. It sets forth a clear framework for evaluating the current health of patients while determining the fundamental needs. With this theory, nurses can set the health goals for their patients and measure their treatment progress. In a case where the condition of patients impairs their mobility, the entire treatment plan should revolve around reducing the pain and promoting mobility. The need theory thus provides content that is critical for preparing students to become effective nurses, and its application is relevant in the present and future times. Its application would also have been critical before its development. Henderson's theory is crucial in guiding research and improving the nursing practice. It provides knowledge that can be used in making clinical decisions that are aimed at providing the best care for the patients. Since the nursing profession is dynamic, it needs a logical approach that promotes problem solving. Consistent research guides the past, current, and future nursing practice and helps in building knowledge through the development of theory. The need theory acts as a foundation for the development of better and more practical approaches that guide the nursing profession in the current and future settings. With such information, the needs of patients can be met and their independence is assured. The application of the need theory varies from context to context. Ensuring that the needs of patients are addressed is critical in the provision of quality care in different settings. The application of this theory into hospital settings is aimed at delivering nursing care and bridging the gaps between theory and practice. The needs of patients should be given priority under a pragmatic plan of care as defined by Henderson. I work in a hospital, and in a hospital that serves over 50 patients per day from different backgrounds and cultures, the role of nurses is critical in promoting the care of patients while having their goals set. The need theory is application in the provision of care for patients at different hospitals. It provides basic guidelines that nurses should adopt in their day-to-day interactions with patients. The major arguments of the theory include meeting the basic human needs while ensuring the independence of patients. When this theory is applied, it provides a clear plan of care where the focus is the well-being of the patients. New nurses joining the profession are guided appropriately by the need theory in their course of duty, with the main aim being the proper care of patients. As these nurses execute the orders of physicians, they are also urged to remain creative in ensuring the best care for their patients. Thank you for taking the time to listen and learn about the need theory of Virginia Henderson.